Well, we started off on a journey trying to, just be committed to delivering quality care. Wanted to be compassionate, accessible healthcare for our community. We're a regional hospital, and we serve a very underprivileged community, but just a lot of pride and a lot of character. Most of our interest with Chime at the time was just seeing how we lined out with other facilities in our area. We were trying to see what systems we had that may have been, antiquated, may need to be upgraded, how we lined out with everyone else, what other people were doing. And that was kind of the interest with Chime initially, as far as the most wired survey, was to just really get a good level playing field of where we were as an organization and where we were trying to move as an organization. It just gave us that digital health checkup, right? That helped us identify areas for technological advancement and innovation. We utilize the recognition from the Most Wired program to strengthen our marketing position and highlight our commitment to leveraging advanced technologies for better, patient outcomes. That's the main drive for all of us, right? To be able to tie those technology advances to a better outcome for our patients.
Mhm.
So that's where the big interest was, and those achievements in the survey that we've managed to acquire. It just shows an excellence in healthcare for our particular way we deliver that healthcare. We primarily feature on our marketing, public relations campaigns. We utilize it in our newsletters. The marketing team does a great job of releasing that out into our community, and it just really helps people know that we take healthcare serious and that we are trying to provide the best healthcare possible in this area. Well, they're pretty integral to our IT strategy planning. They help us prioritize our technology investment and enhance patient care technologies. It helps us ensure that we're aligning with, not only with the industry, but we're trying to move ahead of those industry standards, because we don't want to just be at or equal. We want to be better than those standards. The alignment supports our goals for operational efficiencies and high quality patient care. And we do sit down with our vendors and we have conversations with them about issues that are coming up in the process that are identified during the Most Wired survey, as far as looking at where we are, where we want to be, and identifying how do we get to that next step. What is holding us back? What is that roadblock that we need to get beyond from a technology perspective? Because I think the biggest piece that a lot of us forget on a daily basis is that technology is supposed to be a bridge between the user and the technology. And a lot of times we find that technology ends up being a roadblock in those situations. Well, so we kind of do a little bit different in that we run our Most Wired survey through our PMO here for technology. So we have a various number of people that are pulled into that from the IT clinical perspective, IT technology, help desk, nursing. We really try to involve a lot of people. The thing that was really unexpected was that it really enhanced our internal collaboration. Departments across our system, they all came together to integrate those technologies cohesively. It resulted in smoothing the operations, right, and enriching that patient experience. So the ability that's really important that people don't realize is that it's the long-term effect of that digital initiative on patient outcomes. We're seeing this longitudinal data over time. And I think that's the thing that people don't really understand. That's the most surprising thing. The continuous feedback loop that you get is essential for the ongoing efforts of your organization to refine and advance your digital health strategy, ensuring that you consistently, meet those evolving needs of not only your patients, but your healthcare sector. Yeah, don't be afraid. You have to jump in to see where you are. So embrace the survey as an opportunity to critically assess and refine your digital health strategy. Look beyond the accolades, use the survey's feedback as a roadmap for continuous improvement, and engage with every department to ensure technologies are, not only adopted, but also effective and utilized to enhance the most important thing, the patient care and security. Just you will use it to bring people together, not only inside the organization but outside the organization. It's been essential in conversations with patients as far as, um, we have a team that we go out with and we have conversations with patients and ask them about new technologies and what their challenges are. Overwhelmingly, the thing that we have to understand is that people are wanting that Amazon experience. They are used to having a phone in their hand that gives them access to everything 24/7, 7 days a week. But healthcare systems, even though we say we're 24/7, we're not. We operate between the hours of what, 7 and 5. Most people can't just come in and schedule an X-ray at 6:30 at night. A mother that has been working all day, she has children, and now she's trying to find the most convenient time for her to do those. So this is what Most Wire can help you with. It can help you identify those patterns and really reach out to not only your patients but to your employees and see how can I make their life better and how can we make the organization more essential to our community. I mean, right now we're all struggling with, evaluating our cybersecurity preparedness. So, as digital healthcare evolves, so does the landscape of cybersecurity threats. So I think the Most Wired survey really assesses our cybersecurity measures against those of similar institutions, right? So this benchmarking is pretty vital in identifying those vulnerabilities and enhancing our defenses, that we need to do that collaboratively, right? Ensuring protection of all that data, as well as maintaining trust with our patients and our partners. So I think that's a big piece that has evolved with the landscape that Most Wired has also evolved with. I've noticed that in the last survey, and I'm noticing this year that y'all have definitely put more
Yes.
thought into that process. So to your point, it is daunting. But the other thing too is that CIOs, we have a hard time sometimes letting some of this go because we're held accountable for the final product. But it has given, I give pieces out to my security team, pieces out to my clinical IT team, and really having those open conversations with them about where they think we are versus where the end users think we are, really identify some very interesting disparities that you can work on as an organization.